today, and also pleased to have Dr. Paul Auwaeter, Clinical Director in the Division of Infectious Diseases at Johns Hopkins and President of the Infectious Diseases Society of the United States of America. As a clinician, Dr. Auwaeter sees firsthand the toll that this year's severe flu season is taking on individuals and families. And we are grateful for his willingness to share his expertise with us here today. I'd like to start my remarks with what has become an all too frequent practice, offering my prayers and condolences to a community that has suffered a needless, tragic mass shooting. To the families, students, teachers, and residents of Parkland, Florida, our hearts break for your loss. No community and no school should ever have to suffer the fear and sadness that comes with this kind of tragedy. But my sadness comes with outrage that my Republican colleagues, beholden to the National Rifle Association, have blocked meaningful and sensible gun safety legislation at every turn. Outrage that we have not banned assault weapons and high-capacity magazines. Outrage that after dozens of mass shootings in the past year, Congress has not passed one single piece of meaningful legislation that could address this scourge of gun violence in our country. But those of us who want to get these guns off our streets will not stop fighting. We need to make sure that NRA stands for not relevant anymore in American politics. We need a national debate on this issue so we can give results to the American people. The American people support safer gun laws by overwhelming numbers. The members of the Senate who will be speaking today, they support it, and we will not stop until we get it. But the reason why we are here today is to talk about solutions to another epidemic devastating our country, the flu. With a mild flu season killing 12,000 Americans per year and up to 56,000 during a more severe season, the flu is a formidable foe that costs the nation $10.4 billion in direct medical expenses annually and an astounding $87 billion in total economic burden. This year, all signs are pointing to the most severe flu season since the 2009 pandemic. The CDC will likely provide another update this week on the impact of this flu season. And given what I've seen on the nightly news every evening for weeks, the news will continue to get worse. Hospitals in Massachusetts and across the country have seen a sharp increase in the number of people who are presenting with flu-like illnesses compared to previous years. According to the CDC, 1 in 10 Americans who died the week ending of January 20th died from the flu or pneumonia. 1 in 10 Americans who died. It was the flu or pneumonia. And at least 63 children have already died of the flu. Earlier this week, Massachusetts saw its first pediatric death caused by the flu this year, 6-year-old Delilah from Haverhill. These tragic and untimely deaths are a sobering reminder that as a global community, we still fall so short in our response to this annual menace. It has been nearly 1 century since the historic Spanish flu pandemic killed millions in 1918. But we are still struggling to bring an end to this insidious, infectious invader. Despite the burdens on our communities, hospitals, and schools, our current flu vaccine is only 60% effective at best. Some estimates put the effectiveness of this year's vaccine as low as 10%, and that is simply unacceptable. America's scientists and clinicians are gold medalists in health and disease research, and it is up to the United States to lead the world in the response to the flu. We must enhance our ability to predict the right strain for the next season, produce a more optimal vaccine, and protect all Americans against all strains of this virus. The National Institutes for Allergy and Infectious Diseases spent an estimated $64 million for universal influenza vaccine research in fiscal year 2017. That is simply not enough. And that's why we're calling for a $200 million annual investment over the next 5 years at the National Institutes of Health to develop a universal flu vaccine. We are introducing legislation today, the Flu Vaccine Act, to authorize this level of investment. By providing dedicated, consistent resources, the NIH will be able to perform the basic science research necessary to improve upon our current vaccine, with the goal of ultimately developing a product that protects against many strains of the flu and will not have to be administered each and every year. It is my hope that this infusion of funding, combined with the hard work and brilliance of our healthcare providers and scientific investigators, will help ensure that in the future, flu pandemics only exist in the history books. That is our goal. That is what we are initiating today. And what I would like to do is to introduce Dr. Auwaeter, the president of the Infectious Disease Society of America, so that he can make a statement.
Thank you very much. Appreciate it. Thank you very much, Senator Markey. And I would very much like to thank Senator Markey for the opportunity today, and to thank you for your leadership, recognizing the needed research support for developing a vaccine that is protective against multiple strains of influenza. The flu vaccine bill he is introducing proposes a $1 billion investment over the next 5 years, and indeed, it's a good start at a good time. This has been a serious influenza season this winter. We are witnessing more widespread infection and more severe illness than in the past decade. The consequences include potentially preventable deaths, hospitalizations, and illnesses leading to missed school and work. This clearly speaks to the urgent need for a durable and universal influenza vaccine. The most prevalent influenza strain this year is the H3N2 virus. This particular strain causes more serious illness than the typical influenza strains we've seen, and while at the same time the vaccines produced tend to be less effective because our current manufacturing processes may contribute to unintentional mutations. Senator Markey's bill will provide important resources to overcome this problem. As an infectious disease physician, I have seen and heard some of the devastating results of this year's influenza viral infections. I was working last month in the hospital, and a teenager was admitted to the hospital. A week earlier, she had had a routine pedestrian influenza infection that was thought to be something she would recover from. Unfortunately, the infection progressed, developing acute heart failure and acute kidney failure. I've seen 2 patients in the intensive care unit, both of whom required artificial respiration and ventilation, who have now developed critical necrotizing pneumonia. This is a secondary bacterial pneumonia from which it is very difficult to recover. Cases like this are happening across the country. Such tragedies underscore the serious need to develop broad, effective protection against influenza, regardless of each season's primary strains. New approaches are needed to develop an effective and more durable universal influenza vaccine. Current vaccines are based on our immune system responding to one of the key proteins of the influenza called hemagglutinin protein. Unfortunately, the virus tends to vary this every couple of seasons or every year, and therefore we're always catching up trying to match a vaccine with the circulating strains. It's important that we invest resources necessary to overcome these scientific hurdles, to find new methods, and Senator Markey's bill will be extremely helpful. A coordinated and comprehensive response for influenza research and development will strengthen our public health infrastructure and substantially lead to a more ready and healthier workforce. In addition to a better vaccine, we need improved influenza diagnostics and also antiviral drugs. We need to invest in our public health system so that surveillance and tracking of something like influenza, we can understand its impact and how we can better prevent infection. This will help inform policies to increase the number of individuals who will receive the influenza vaccine. Currently, the Centers for Disease Control recommends everyone over 6 months of age receive the vaccine. Dedicated requirements that healthcare personnel receive flu shots to protect their own health and to prevent spread to their vulnerable patients also have been highly effective. This influenza season also underscores the importance of a highly skilled workforce of clinicians, researchers, and public health experts who can swiftly mobilize to address severe influenza by caring for critically ill patients, conducting research for vaccines and other countermeasures while implementing public health interventions. Recently, fewer young physicians are pursuing the field of infectious diseases, yet there's increasing demand for this expertise. How medical students and young physicians choose careers have been strongly influenced by their financial burdens. Strategies are clearly needed to address the high financial burdens of medical education, as well as compensation in a field where these practitioners earn significantly less income than other physicians who spend as much time in training. The severity of the influenza season is also compounded by another public health crisis, and that's antimicrobial resistance. Many of the hospitalizations for influenza, including the patients I mentioned in the intensive care unit, actually are ill because of secondary bacterial pneumonia. And these bacterial pneumonias are increasingly difficult to treat due to antibiotic resistance. The scarcity of new antibiotics in development mean there will be worse problems with untreatable infections, such as from bacteria, as they continue their relentless development of resistance to these miracle medicines of the 20th century. What we need now are research efforts and incentives to stimulate new miracle drugs for our patients in this century. This year's influenza season has highlighted many of the ways we can do better in protecting individual and public health by developing new tools and ensuring access to the ones we have. Senator Markey's proposal is a good start at a good time. It will speed the way to a time when influenza season doesn't inspire dread.
Beautiful.
Thank you.
Thank you, Doctor. And now, my co-sponsor on the legislation, Senator Klobuchar from Minnesota.
Well, and thank you for going on for a little bit so I could make it. I mostly just want to thank Senator Markey for his incredible leadership on this and our other co-sponsors, as well as you. Thank you very much. I actually gathered with some of our doctors and medical professionals in Minnesota on Sunday. Obviously, we always are a state, being a northern state, that gets hit by the flu. But what we're seeing this time, for the first time in 13 years, the Centers for Disease Control and Prevention report that every part of the continental U.S. has experienced widespread flu. This season is reported to be as bad as the swine flu 9 years ago, and last week an estimated 1 out of every 13 trips to the doctor was for patients with flu-like symptoms. In our state so far, there have been more than 3,800 influenza-related hospitalizations, and just some comparison to that, we had about 3,700 total for the whole flu season last year, and we're only partway through. So that just gives you a sense of what we're seeing. I am seeing this in my own life. One of the doctors that was there on Sunday had a little baby that got very, very sick, and he's a flu researcher, so he knew what to do. Well, not everyone has that kind of training, and he was immediately in the emergency room. I have someone that is worked for me, and her fiance got the flu and died a few weeks ago. I was at the funeral on Saturday. And so these things are happening across the country. And this idea that we have a flu vaccine that targets only 3 to 4 strains of the flu and ranges in effectiveness from 10 to 60% is just something that we don't accept in a country that has had so many medical developments. Minnesota is home to the Mayo Clinic and the University of Minnesota and some of our leading medical device manufacturers. So I've seen firsthand the miracle of separating conjoined twins, of developing the pacemaker, all of these things. And I cannot believe in this day and age that we cannot develop a more full-fledged, and as Senator Markey would tell us, universal flu vaccine. So I'm honored to be a part of this. We know these breakthroughs don't happen overnight, but with the kind of researchers and smarts we have in this country, we can get this done. Thank you.
Next, Senator Richard Blumenthal from
Thank you.
the state of Connecticut.
Thank you so much. First, my thanks to Senator Markey for his leadership in providing this opportunity, and it is an opportunity born of a catastrophic challenge. We have seen a record number of flu cases this year. Up to 4,000 Americans are dying each week as a result of the flu. Who would have thought it in the greatest, strongest country in the history of the world? But here we are. And out of that catastrophic tragedy for many families is this opportunity to learn and do better. And in Connecticut, we know all too well about the devastating effects of the flu, from the deaths and the illnesses that we have seen. The death, for example, of a 10-year-old named Nico Malazzi, who left his home in New Canaan, Connecticut, not far from where I live, for a hockey tournament in New York. By the time he had arrived home, he had died because of the flu. 10 years old, Nico Malazzi left his home for a hockey tournament and died before returning. That simply should not happen. And it's within our reach to avoid it happening. Developing a flu vaccine that applies more effectively, investing in that scientific development can be one of the great boons that we do here in the United States. There are very few life and death issues where we can make a difference. This is one of them, and we have an obligation to do it. I'm proud to join in the Flu Vaccine Act, and I look forward to working for it vigorously. And again, my thanks to Senator Markey and Dr. Auwaeter for being here. Thank you, sir. And to all of the advocates, thank you.
Questions? Anybody?
Hi, I'm Jeannie Bauman with Blumenthal. If you're able to get this vaccine through as a result of this $1 billion, what responsibility then do you think the people who set the prices for whatever this vaccine would have to make sure that it's affordable for everyone and the taxpayers who help?
I will say that that is an issue which is of a great concern to the three of us who are sitting here. We I think with one mind on this issue, and we would work hard, being the group that would have worked to ensure that this funding is in place and that the scientists work to find the cure or find the universal flu vaccine, that it be affordable to every American so that we can give a vaccination to everyone in the country.
Yeah, I can only speak for myself. With the federal government investing so heavily in the research and development, the people of the United States have a right to this vaccine, and that it be affordable and available to every single man and woman living in the United States. Let's remember that somebody who is denied this vaccine is a danger, a public health danger, not through any choice of her or his own, but we're dealing with a contagious disease. And so there is a profound public obligation to make it available to everyone.
As you know, there have been issues before about this when there's federal investment, and this would be a major federal investment. So I think that the rules, we would want to make sure the rules that apply to a vaccine like this make it clear that this is universal, and universal means that it goes to everyone, and it also means that it's universal in terms of how it works. The other thing, and I don't want to go on about all the proposals out there, but Medicare Part D negotiation would be helpful in all cases with pharmaceuticals, and I am personally a fan of doing something with reimportation, less expensive drugs. But what we want to do here is get something that works in our country, and are sometimes getting things from other countries, but that's not working either. So we want to develop something new.
Thank you all so much.
Thank
Okay?
you. Thanks,
Thank you.
everyone.
Thank you for your
You're great.